Hi, this is Michael Weiss, and this show, it's Healthcare Reality, but this one is about pain management specialists. Let's see, it's Thursday, April 8th, 2010 or so, and this topic came to me because I read a couple of posts on a Crohn's and colitis message board, and it pained me to see the kind of pain that some of these patients were in. So I made a couple of posts about my experiences, and I have Crohn's disease. I've had it for about 25 years. I've been hospitalized over 150 times. I've had 15 major surgeries. I've even written a book about it called Confessions of a Professional Hospital Patient. It's handy right here. If you go to hospitalpatient.com, you could purchase a copy. And I go into more detail in the book, obviously, about my real-life account. And it's a funny real-life account, but it's instructive. And today I wanted to talk about pain management specialists, because a lot of doctors, even though they have the greatest of intentions, a lot of gastroenterologists, particularly with Crohn's patients, they don't want to prescribe narcotics. It's not in a patient's best interest to get addicted to drugs, and obviously that's something that we appreciate. But then again, there's a fine line between dependence and addiction. And if you have chronic pain, and a lot of Crohn's patients have chronic pain, the pain is going to prevent you from having a lifestyle. And some people would choose to have the pain and be disabled maybe and lay on the couch, and that would be their right. I chose to treat the pain and have an active life, and sort of make sure that pain management specialists were monitoring me to make sure that I never crossed that line from dependence into addiction. So when I asked my gastroenterologist for pain meds, they would give me medication, but I always got the feeling that they were a little bit reluctant to give me really what I needed. I'd always have to call for more. And it wasn't until I was hospitalized so many times that I learned that hospitals had pain management specialties, which grew out of anesthesia departments. And these were docs who treated patients, let's say with bad backs or bad necks, with injections, and then they'd see them outside of the hospital, prescribe different medications. And really, it's all about the patient's lifestyle. And as long as the doctor prescribes the right drugs in the right amounts and the patient doesn't abuse it, it's great. It's just not how it works, because a lot of patients abuse it, and therein lies the problem. So this is how I've gone about it, and I think I've been very successful at it, and I think my doctors have been very successful at it. I'm not going to say that I don't have flare-ups, that even with pain medication I may still wind up in the hospital, or I may lay on the couch. But for the most part, I'm able to depend on the medication to live a relatively normal life, as long as it's under the supervision of my doctors. So what I would do is I would ask my gastroenterologist for a referral to a qualified pain management specialist. I don't want to go to a pill-pushing doctor. I want to go to a doctor who understands my illness and is going to treat me accordingly. Now, I relocated from New York to LA about 5 years ago. It's a big move for me. Even though I was 42 or 43 at the time, leaving my doctors in New York, particularly my pain management doctor, was frightening. And for that sole reason, I knew I had to do it. So what I did was I got referrals for about maybe 2 doctors' names. And every time I'd come out to California on a business trip, I would schedule an introductory appointment with that particular pain management doctor. And I highly recommend that you do this. So before you take on a pain management doctor, make an appointment as an introduction. You don't want any medicine, you don't want any pills. The purpose of the meeting: give your patient records to the doctor so he or she is familiar with what's wrong with you. Explain to the doctor how your pain's been managed in the past, what's worked for you, what hasn't. Maybe there's different phases. Maybe you take a certain type of medication when your pain is here. Maybe you take a different type when it's there, and then when it's here you go to the hospital. But communicate with the doctor and try to get a feel whether your lifestyle and your needs will be compatible with the way that doctor practices. Well, I had a bad experience actually, because this doctor yesed me to death, even though I gave him all this information. And I subsequently moved to California, and the stress of moving caused a flare-up. when I called his office, this was months later, and said, hey, I need that medication, whatever it was a narcotic, he had an associate handling the calls. I guess he was off or busy, and the associate says, if you're that sick, then go to the hospital. And I was like, well, the reason why I'm using a pain management specialist is so that I don't have to go to the hospital. You know my records. You've already agreed to treat me in this manner. I'll certainly come in, but I went in and still the same thing. And they don't want to put their rear end on the line because they're highly scrutinized by the DEA, as they should be. I just didn't like this. I felt it was a bait and switch. This doctor wanted my business, but then when push came to shove. So then my search while I was in LA, and I was quite panicked, for a pain management doctor began all over again. So then I had another experience. Again, I made an introductory visit with a physician, a very well-respected doctor at Cedars-Sinai who came highly recommended. And I waited in the patient room, and the nurse came in, or the assistant, and said, well, you're going to have to disrobe and put on a patient robe. I said, look, this is not that kind of visit. I'm here to really just sort of get a feel for the doc, have the doc get a feel for me. And she said, well, this is a hospital, and you have to, yeah, it was like Nurse Ratched, and I just got the feeling this was not going to be for me. And I waited, I was respectful, I did what I had to do. But then I realized that even if this doctor was the greatest guy in the world, this environment was not going to work for me. I left and I said, look, this is not for me. I don't want to waste your time, don't waste my time. I asked around. I finally got to the right doctor. And when I got to the doctor, it was amazing because I told him all these stories, and he was so compassionate, and he felt bad for me for having to go through these stories. I mean, pharmacies could make you feel guilty for having to fill a large prescription. It's almost like discriminatory. Not when I went to this doctor. This doctor was perfect, okay? But he laid down some laws that every pain management doctor will make you adhere to, and you must adhere to them because your credibility protects them and enables them to stay in business. And people with chronic pain need these doctors to be in business. And what are those parameters? One are you sign an agreement with the doctor. You will not get narcotics from another doctor. And in my case, at times I'm bi-coastal when I'm healthy, and I may have to get drugs from a different pain management doctor in New York. They know about each other. So anytime I have, God forbid, a crisis in New York, they communicate with one another. So each doctor knows what I'm getting. I'm not what they call doctor shopping. That's one. And two, you have to get the drugs at the same pharmacy, which is probably close to the doctor's office. It's people he trusts because they have his back. And the reason for this is so that the doctor has records that are pristine in case he's ever investigated. And this is for your best interest. So I know I laid a lot of information on people here, but the bottom line is pain management is a specialty that is filled with compassionate physicians who want to help you live your life despite your chronic illness. There are a lot of doctors there, though, however, who treat it as a way to, they kind of have control over your life. So when you meet with these doctors, make sure that this is a doctor you could coexist with. How many times a month will you have to visit him to get your medications? A lot of times they do drug testing in a random nature, and you must agree to it. And if you don't agree to it, then they shouldn't take you on as a patient. This is serious business. And you have to entrust in that doctor that if they feel that you're falling into the addiction as opposed to dependence, they're professionals. You have to trust them. And don't be annoyed at gastroenterologist or your general doctor who doesn't want to take on this responsibility. I understand it. It's a specialty. They know that Crohn's is painful. They'll give you some meds, but ultimately pain is an aspect of Crohn's disease that needs to be treated separately. That's been my experience. It's made my life fairly bearable with Crohn's disease, and I think it would help you as well. And there are so many good, qualified pain management doctors. Notwithstanding that, you hear the Michael Jackson stories and all the celebrities and all that stuff. You got to stay away from those doctors, okay? You need to go to credible doctors, and people could reach me. You could purchase my book, which has the information. You could go to the website, email me, and I will share with you whatever information I can. And I think the general rules I've laid out will work for you no matter where you are in the country or the world for that matter. So thanks for listening, and we'll put another video up when another topic seems to be important to address. Thank you.